This PowerPoint will be focusing on the scaling and root plating procedure and periodontal maintenance. So what are the determinations for periodontal? Is there visible subgingival calculus on the x-rays? Is there visible bone loss on the x-rays? Is there 4+ millimeter pocketing? Bleeding upon probing? Moderate to severe inflammation of gum tissue? A side note is if a periodontal maintenance patient has 2 maintenance appointments where all periodontal conditions have returned to healthy levels, they may be scheduled for future prophy appointments with strict monitoring of periodontal conditions. This is an exception, not the rule. It is very rare that this happens. We know that once a patient has periodontal, typically they are a periodontal patient for life. Scaling and root planing. So if a new patient or existing patient presents, and in the exam there's a combination of periodontal probing, bone loss on the x-rays, and other indicators that dictate this patient needs active therapy due to periodontal conditions, then we need to do as follows. We need to go over the periodontal classification worksheets with the patient. We need to show the patient what periodontal disease is, educate them using any material you have available, and using the American Dental Association videos. These are all great tools in order to educate the patient on what you are discussing. These are examples of the periodontal worksheets that the patient will receive. First one being the notification of periodontal condition, where we rate them. The hygienist will go ahead and check that. Then we have the statement, letting them know that they understand that periodontal disease is a progressive condition that can affect their overall health. Letting them know that they are aware that the emerging research indicates a link between gum disease and a variety of other health conditions, which include heart disease, stroke, diabetes, lung infections, and other degenerative diseases, which can be life-threatening. We have them sign saying that they understand the recommendations for treating this condition and that there is no cure for periodontal disease. By signing this, they are aware that treatment will attempt to arrest and control the process from progressing. They say that this has been explained to me and that I need to receive the proper ongoing care. We have them sign, and then we also have the dental provider sign as well as date. The next one is the periodontal classification worksheet. This is where we have a rubric on how we go ahead and put them into one of those categories based on tissue appearance, bleeding, calculus deposits, pocketing, bone levels, mobility, and then patient management issues. And then we can also include other notes that the provider may want to include. We go ahead and total up those points and then put them in the category corresponding. Again, getting a patient signature and date. It is very important for the patient to go home with a copy of these sheets as well as us to have a copy scanned into our system. Documentation is one of the most important things we can have, so if we ever need to refer back to something. Scaling and root planing treatment planning. So what should we include in the treatment plan? We want to include the scaling and root planing appointments, whether it be all 4 quads, 4+, or localized 1 to 3 quads, whatever it may be, we need to include that in the treatment plan. Include the code for chlorhexidine. Include a 4 to 6 week healing check if applicable. Now, we typically do not do the 4 to 6 week healing checks anymore unless the hygienist feels the patient will need special attention. 4 to 6 week healing check, if determined that a patient would need this and need to be seen prior to the normal 3-month periodontal maintenance appointment, then we go ahead and schedule that 4 to 6 week check. At this appointment, a full mouth probe will not be done. The focus of this appointment, in turn, will be on how is the patient doing? Are they following their home care instructions? There is no charge for this appointment. This is a free appointment. Now, typically, once SRP is completed, the first appointment the patient will have is a 3-month periodontal maintenance appointment. At this time, we will recheck the probing. We will evaluate how they're doing, how the response is, and if the patient is following their home care instructions. Next, we want the patient to be made aware of how their insurance will cover the SRP that we have treatment planned and their periodontal maintenance appointments. We will give them a special worksheet that shows them what we are recommending, how many times we believe they need to be seen a year for periodontal maintenance, what the insurance will cover based on their insurance plan, and how many times a year they need to be seen with us. And then also, what is our fee associated? There may be a point where we need to discuss possibility of delivery of a localized antimicrobial in case it might be needed. It is a good idea to talk about that at the beginning treatment plan stages so the patient at least has it in their mind. That if after the SRP we notice there are some areas that could receive a little more healing or not responding how they may need to be, then we may need to deliver this localized antimicrobial and hopefully see improvement in that regard. At least put it in their mind so if we do have to cross that bridge, they are aware. So scaling and root planning standard of care, how we do it in our offices. We're going to be breaking down the types of scaling and root planning. So a 4+ per quad treatment for scaling and root planning. If a patient presents and they need a scaling and root planning, 4+ per quad, we will complete the SRP when the schedule allows, and then the patient will be scheduled back for the 3-month periodontal maintenance. The scaling and root planning standard of care for 1 to 3 per quad. The 1 to 3 per quad code is intended for somebody who may not have as advanced as a 4+ per quad. So for example, SRP can be done on 1 tooth, and that is the purpose of the 1 to 3 quad code. Here we go. If a patient only has 1 quad that requires 1 to 3 scaling and root planning, the hygienist will complete prophy at the current appointment, and then the patient will be rescheduled for the 1 to 3 scaling and root planning. The future recall appointments are an adult prophy with strict monitoring of periodontal conditions. If a patient has 2 or more quads that require 1 to 3 scaling and root planing, the patient will complete SRP and be scheduled for periodontal maintenance for future recall appointments. Some cases there may be where a prophy is done on the same day of SRP 1 to 3 diagnosis. So for example, patient presents, there's only really 1 quad that needs SRP 1 to 3. You are allowed to complete a prophy on that patient because most of the quads don't need the 1 to 3. And then we can either schedule them back to get that 1 to 3 done on the quad that needs it, or we can wait and just get them back and do it all at one time. Since a good portion of their dentition only requires preventative treatment, completing a prophy prior to SRP 1 to 3 is appropriate, as I just stated. An adult prophy will be charged out at this time. Now, sometimes the schedule does not allow. So, in that regard, we get the patient back, complete the SRP 1 to 3, and we just do a complimentary prophy. Typically, insurance will put a limitation, meaning if you don't do that prophy at the first appointment, you can't do it when you're doing the day of the SRP. And that's why it's, again, important to look into the patient's insurance coverage. So now beginning treatment. We've presented the treatment plan. It's time to get started. Getting the patient scheduled is the goal. Schedule treatment once treatment plan has been accepted. We don't want to let the patient leave without having a scheduled date for treatment. Do the best you can do. Show them the schedule. Let them know that we are booked out a ways. If I don't get your name in here, I'm afraid I'm going to have to put you out quite a ways, and I don't want to do this. I want to get this treatment completed for you as soon as possible. Get the patient to schedule before leaving the office. So now the patient presents back for their SRP appointment. Biggest thing with any appointment is we want to review the health history. Has there been any changes? If so, go ahead and document accordingly. We will then deliver the necessary anesthetic. Following, we will perform the SRP using our Cavitron, hand scaling, or SAS instruments, or a combination of all. Once the SRP is done, we want to make sure to always use our self-check methods. You can use that using a variety of tactics. We can use our floss, exploration, air, and we could even use bite wings if necessary, comparing the bite wings before the scaling and replaning versus after. We then want to flush all the areas with chlorhexidine. Explain it to your patient. Always explain what you are doing. So for example, Mrs. Jones, I'm now going to flush the pockets with a prescription antibacterial mouthwash as a goal to reduce the amount of bacteria within the oral cavity. I will be sending you home with a bottle of this today as a medicine to use as I instruct. Share before and after pictures of what you've done. Show the patient, this is what I've been doing, this is what I've been working on. A lot of times your patient will be in awe because they might not really realize what you're saying unless they see it. For example, this is a picture that a hygienist took of a 22-year-old female who presents for scaling and replaning. It's a lower anterior comparison showing the right side quadrant being completed versus the left side that is untreated. Sometimes what a patient can see is what is key. Another example that a hygienist took is posterior, lower right, lingual. 30-year-old female presents for SRP. They took a before picture and after picture. Notice the difference between this picture and this picture. Notice the difference in the tissue appearance within 1 hour of each picture being taken. This picture shows an intraoral picture taken to show patient calculus buildup and tissue appearance. So this patient presented for regular 6-month prophy. Their last visit to the office was about 3 years ago. Upon arrival, the patient had localized 5 mm depths posterior and heavy supra as well as subgingival calculus deposits. So the recommendation was scaling and replaning for quadrants of 1 to 3 per quad. Show the patient the picture. Show them the calculus deposits you're talking about. Show them that not only is it what you can see or the eye can see that I'm showing you, but it's what's under the gums that's really causing the effects. Again, a picture is worth 1,000 words. This is an intraoral picture that a hygienist took. Upon her instrumentation with the Cavitron during SRP, she caught several areas of that subgingival calc as it was being released. The hygienist collected and saved it on a 2x2 gauze to show patient after the procedure. She showed them this is exactly what was being removed under the gums. These are the pieces. This is the cement-like material that I am removing under the gums. So once everything is completed and the SRP is completed, we always want to discuss post-op instructions and answer any questions the patient may have. Let them know what is to be expected, how to manage it, and to always call if they need anything. We want to schedule a follow-up. So if we determine that they do need a 4 to 6 week check, which is very minimal, but some do, then we go ahead and schedule that. But mainly the first appointment we'll schedule following the scaling and replaning would be their first 3-month periodontal maintenance appointment. Get them scheduled. Try not to let them leave without scheduling. You want to follow up with your patient. We feel it is very important to be personable with our patients. Let them know we care. And we show that by giving them a quick phone call after their scaling and replaning appointment. During this call, make sure they are doing okay and answer any questions they may have. For example, if you saw a patient in the morning, maybe wait till later afternoon to call them, check in with them, ask them how they're doing, leave them a voicemail if they're not available. If you saw the patient in the afternoon, maybe wait till the following day, and again, give them that follow-up call. Let them know we truly care.